My presentation is over an occupational therapy approach to mental health. The objectives from this presentation are learning ways to design mental health interventions from an occupational therapy perspective, understanding cognitive impairments and their impacts on quality of life, and how to use inspiration instead of focusing on motivation for recovery. So why would you use occupational therapy for mental health? Typically, when people think of mental health problems, their initial thought is a therapist and cognitive behavior therapy. Although these work very well, they are not the only way to help with mental health. Another misconception is that mental health is a linear problem that can be solved with pills or just seeing a doctor or therapist. This is not the case, and in most situations, it is typically a collaboration of many different health professionals, as well as loved ones. The focus is not necessarily just mental either. Occupational therapists take many factors into consideration, especially activities of daily living, and puts them into account for the patient. Mental health also overlaps with one's physical health. Mental health problems and physical problems may be caused by each other in some situations and can go hand in hand. A couple of examples of this is a patient that loves to make art may be losing motor skill from a physical problem, which can then lead them to feeling depressed, which has mental effects on this patient. This can also go the other way with a patient that feels depressed who then avoids physical activity, which is then a mental problem affecting physical health. In many health professions and in occupational therapy, the recovery model would be used in situations like this. What makes the recovery model more effective in these situations than the medical model is that the recovery model is more client-driven and holistic, meaning the patient or client works towards the goals they want. This model is also nonlinear and can go in many directions, since all patients are different and mental health issues are also nonlinear. This model is also good because it is designed around many professionals and considers that a patient may be visiting more than one professional for care. This also has a good overlap with occupational therapy since the recovery model considers the different dimensions, with it being nonlinear and it's patient-driven with what is meaningful to them. Occupational therapy can also be utilized for cognitive impairments. These impairments can range from mild to severe, and they involve trouble remembering and learning new things, as well as concentration and decision-making. Occupational therapists will also assess patients' ability to carry out everyday tasks, as well as their environmental awareness of their surroundings. One of the main things occupational therapists do is help improve independence for activities of daily living. Some treatment methods for cognitive impairments include working with the patient to help reduce behavior problems. This will help reduce the patient's stress and feelings they may be fighting from things such as forgetting how to carry out an activity. The goal is to lessen the amount of care needed to help the patient be more independent as well as caring for themselves and keeping up with it. Healthcare professionals can only do so much, and at some point, the patient may have to stop seeing the professional and return to functioning on their own. A great approach to this can be a focus on inspiring the person rather than motivating, since inspiring will fill a person with urge and can help build habits, while motivating may just get someone to keep it up for a little until they fall out of it. Environments need to be created for those to feel inspired and then find their own motivation rather than solely seeking motivation. So why should the focus be on inspiring instead? Inspiring will lead to more long-term effects and will be stronger than motivation, which tends to be more short-term. Inspiration is a motivational state and will not need a healthcare professional afterwards to keep their motivation up. Some methods of inspiration include building a sense of purpose, autonomy, belonging, and self-worth for the patient, helping them stop doubting themselves, building trust and other meaningful relationships, listening to the other person, and showing them how to take care of themselves. All of these things can be applied to anyone and not just patients. On a professional level, these methods and models can help with patient care. On a personal level, it can help loved ones or friends with you in being there for them. With these methods and models, you can also help yourself regardless of what struggles you are going through. Whether it may be mental health problems, cognitive impairments, or even finding ways to make sure patients keep up with themselves after therapy, these methods and models, such as the recovery model and self care, go a long way to inspire those around us.